Hi friends, welcome to the next set of questions in the AIIMS Norcet series. So you are watching the Nurse channel. So as you all know that we have started a new series known as the AIIMS Norcet series to prepare you well for the upcoming AIIMS Norcet exam, which is expected to be happen on the coming June. So as I told in our older videos, this video also contains nearly 15 questions, very important questions which are taken from various aspects of our nursing subjects, and I have given such a very good explanation for each and every questions. So it is my humble request to all our subscribers to watch the video till the end without skipping, because each and every options and its explanations are also very important, and I have included picture based questions, picture based explanations in this session. So definitely this will help you to prepare better for your upcoming examinations. So straight away, moving without losing time, we will move on to the questions. Before that, I request everyone who not yet subscribed our channel, kindly subscribe our channel and support us, and kindly share about this platform to your nursing friends. So straight away we will move on to the third question series in the AIIMS Norcet series. So we will move on to the questions. So we are going to see the first question in the series. So the first question for you is in the screen right now, and the question is from the community health nursing. So which among the following viruses is bullet shaped? So very simple question. Which among the following viruses is bullet shaped? And the options are option number A, HIV, option number B, polio, option number C, rabies, and option number D, paramyxovirus. So among this, which is bullet shaped? So first question itself is a simple question. So the answer for this question is option number C, rabies. So now we will be seeing the shapes and sizes of all these four viruses. Okay. So first we will see the answer for the question, that is a rabies. So in the picture you can see right now the rabies virions are bullet shaped with 10 nanometer spike like glycoprotein peplomers, which is covering the surfaces. So rabies virus, as you all know, that it is otherwise known as the rabies Lissa virus, which is a neurotropic virus that causes rabies in humans and animals. Okay, so bullet shaped, that is a key point in this question. Okay, so the other options are, the next option was regarding the polio virus. So you are seeing the structure of polio virus in the screen right now. So we can see it is the simplest of the small spherical viruses. Okay, this is the simplest of the small spherical viruses built entirely from protein and RNA. So this is an RNA virus that you can see in the picture, and this is the simplest form of the spherical viruses, that is a polio virus. So the third option was regarding the HIV. So this is the structure of HIV. So you can see that HIV forms a spherical membrane enveloped pleomorphic virions which contain two copies of its single-stranded positive sense RNA genome. So if you are getting a question regarding the structure of HIV, so after seeing this picture, you can see that it is spherical in size, and you can see that double-stranded, that is two copies of its single-stranded positive sense RNA. So you can see that this double-stranded, you can see and you can identify this is an HIV virus. Okay, so I think that this was very informative. Now the next virus that I have given in the option was the polymyxovirus, otherwise known as the mumps virus. This belongs to the paramyxoviridae family. So here this mumps virus also is an irregular spherical shaped non-segmented negative stranded RNA virus. Okay, it's a negative stranded RNA virus in the paramyxoviridae family. Okay, so that's regarding the mumps virus. So the first question itself was very informative and a very good question that can be expected in your exams. So now we will move on to the next question, that is the second question. So this question is, sweat chloride test is associated with dash. Sweat chloride test is associated with dash. So the options are option number A, Tay-Sachs disease, option number B, sickle cell disease, option number C, cystic fibrosis, option number D, pulmonary tuberculosis. So sweat chloride test is associated with dash. So the answer for this question is option number C, that is cystic fibrosis. Okay, so in the explanation for this question, we will be seeing the diagnostic measures for all these 4 diseases. Okay, so first we will see regarding the cystic fibrosis. So the sweat test measures the concentration of chloride that is excreted in sweat. So it is used to screen for cystic fibrosis, and due to defective chloride channels, because of cystic fibrosis there will be defective chloride channels, the concentration of chloride in the sweat will be elevated in individuals with cystic fibrosis. So a sweat chloride concentration of 60 millimoles per liter or more is indicative of the diagnosis of cystic fibrosis. So you are getting some more information from this paragraph. So cystic fibrosis, sweat chloride test and the concentration. If it is more than 60 millimoles per liter, then we can confirm the diagnosis of cystic fibrosis. Then the other options we will see and how we will diagnose that diseases. So then next option was regarding the Tay-Sachs disease. So it is a rare genetic disorder passed from parents to child, and it is caused by the absence of an enzyme that helps break down fatty substances. Okay, so there will be an absence of an enzyme that helps break down the fatty substance. As a result, what will happen? These fatty substances, which are called as the gangliosides, that build up to toxic levels in the brain and in the spinal cord, and it affects the function of nerve cells. So this can be identified by a blood test that measures the hexosaminidase A activity. Okay, so this is diagnosed by a blood test that measures the hexosaminidase A activity. Okay, so that is Tay-Sachs disease. Then the next option was regarding the sickle cell disease. So we know that the best way to check for the sickle cell trait or the sickle cell disease is to look at the blood using a method called high performance liquid chromatography or HPLC, high performance liquid chromatography. So this test identifies which type of hemoglobin is present. Okay, so whether it is sickle shaped or not. So regarding sickle cell anemia and all, we have explained very well in our old videos. You can go through that. And the last option is regarding the pulmonary tuberculosis. So that you very well know that the diagnosis of pulmonary TB is definitely established by isolation of the Mycobacterium tuberculosis from a bodily secretion or fluid. That may be the culture of sputum, bronchoalveolar lavage or pleural fluid, or tissues like pleural biopsy or lung biopsy, etc. Okay, so that you know very well. So I am not explaining much. So that's all regarding the second question. Now we will move on to the third question in our series. So the question is, which layer of blood vessel is entirely made up of connective tissue and have nerve and capillary nutrient supply? Okay, so the question is, it is entirely made up of connective tissue and have nerve supply and capillary nutrient supply. Okay, so that's the question, and the options are, so the first option is Tunica media, second option is Tunica adventitia, then third option is Tunica intima, and final option is all the above. So first of all, you should understand the layers of the blood vessel, then we can answer it very easily. So in which layer it will be, in the middle or the last layer or in the first layer, like that. So what is the answer? So the answer for this question is option number B, that is Tunica adventitia. Tunica adventitia. So Tunica intima, this is the thinnest layer of the blood vessel, and it is the a single layer of simple squamous endothelial cells glued by a polysaccharide intercellular matrix, which is surrounded by a thin layer of subendothelial connective tissue interlaced with a number of circularly arranged elastic bands called the internal elastic lamina. Okay, so you should understand that Tunica intima is the thinnest layer of the blood vessel, and it contains several types of tissues. Not only connective tissue, it has simple squamous endothelial cells, then polysaccharide intercellular matrix, and then subendothelial connective tissue. These three things are there, and it has a elastic bands which is called as the internal elastic lamina. Okay, so that is Tunica intima. Then comes the Tunica media, that is the thickest layer in the arteries, and it has circularly arranged elastic fiber, connective tissue, polysaccharide substances. The second and third layer which are separated by another thick elastic band which is known as the external elastic lamina. So in the tunica intima we have explained about the external elastic lamina, sorry, internal elastic lamina. Here we have the external elastic lamina and many types of tissues, okay, not only connective tissue. Then comes the last layer, that is a tunica adventitia, which is the answer for the question we asked in the It is the thickest layer and it is entirely made up of connective tissue, and it also contains the nerves that supply the vessel as well as the nutrient capillaries, that is vasa vasorum, okay, in the larger blood vessels. Okay, so these are the information regarding the layers of blood vessels and its anatomy. Told cells are present in these layers and their functions. Okay, so I think you are getting a bunch of information from this question. Now I think we can move on to the next question, that is the fourth question, and the question is, which among is secreted early in an immune response? This is regarding some immunoglobulins, and the options are option number A IgG, option number B IgA, option number C IgM, and option number D IgE. So which one is secreted early in an immune response? So many times we can expect a question from this session like immunoglobulins. So the answer for this question is option number C, that is IgM. So we will have a small key messages regarding the immunoglobulins, some takeaway messages. So IgM, some key point is like it is secreted early in an immune response. Okay, so that is IgM. Then comes the IgG, which is the most abundant antibody in our body, that is the IgG immunoglobulin. Then next is the IgE. IgE is the mediator for common allergic responses. Then IgA, it is found in the secretions of digestive, respiratory, urinary and reproductive systems, as well as in the breast milk and in the tears. So questions can ask like the immunoglobulin which is present in the breast milk or in the tears, like that questions can come. Which is the mediator for the allergic responses, like that questions can come. So in any form questions can be asked from these sessions. Okay, you can thoroughly learn about these immunoglobulins later. So then IgD, that is found on the surface of many B cells, that is its function is mainly unknown. Okay, so now we will move on to the next question in the series, the fifth question. You know about the Adam's apple. So this is the Adam's apple. So this Adam's apple is formed by which cartilage? Okay, Adam's apple is formed by which cartilage? So the options are option number A cricoid cartilage, option number B thyroid cartilage, option number C epiglottic cartilage, and option number D arytenoid cartilage. So these are the cartilages that you can see in the neck region of our body. So which cartilage is formed by which cartilage is actually the Adam's apple? So the answer for this question is option number B, that is thyroid cartilage. Okay, so you know that Adam's apple is the colloquial term which is used to describe what is officially named the laryngeal prominence of the thyroid cartilage, the largest of 9 cartilages in the larynx. So in the larynx we have nearly 9 cartilages. In that, the largest is the thyroid cartilage, and the laryngeal prominence of the thyroid cartilage is known as the Adam's apple. So other part of the larynx and the trachea consist of other types of cartilages, which include the cricoid cartilage, epiglottic cartilage, arytenoid cartilage, etc. Okay, so I think that also was a very informational question. Now, why in males this cricoid cartilage or the thyroid cartilage have this much prominence? Why Adam's apple only in males? So that reason I am telling now. During puberty, this testosterone makes the male's vocal cords grow thicker and longer. So the cartilage surrounding the larynx also grows and then tilts slightly forward, forming the Adam's apple. So while the Adam's apple protects the voice box from injury, it does not serve any other purposes. Okay, so it will just protect the voice box from the injury. Other than that, there is no other purpose. So testosterone is the key thing that plays in the development of Adam's apple in the males. Okay, so that's all regarding that question. Now we can move on to the next question, that is the sixth question, and the question is, the pneumotaxic center is located in dash. Pneumotaxic center is located in dash. So the options are Option number A, upper pons. Option number B, medulla. Option number C, lower pons. And option number D, hypothalamus. So where pneumotaxic center is located. So the answer for this question is option number A, that is upper pons. Okay, it is in the upper pons. So the pneumotaxic center, which is located in the upper pons, sends inhibitory impulses to the respiratory center, terminating inspiration and thereby regulating inspiratory volume and respiratory rate. So the pneumotaxic center and the apneustic center in the pons is very important in regulation of the normal respiration. So this is we are talking about the pneumotaxic center, and it is a center that inhibits the impulses to the inspiratory center, terminating inspiration and thereby regulating the inspiratory volume and respiratory rate. Then next is the apneustic center. So this is located in the lower pons, okay, and it is thought to excite the inspiratory center. Rather than abruptly sending the signals to the inspiratory muscles to contract, stimulation of the apneustic center leads to a gradual increase in the firing rate of the inspiratory muscles. Okay, so I think you got the differences between and the functions of apneustic center and the pneumotaxic center. Okay, these two centers are very important. So we will move on to the 7th question. So another physiology. In contractile cells, inward diffusion of dash causes depolarization. So in all contractile cells, okay, so this depolarization particularly to the cardiac muscles I am telling. So in contractile cells, inward diffusion of dash causes depolarization. That's the question, and the options are option number A, potassium, option number B, calcium, option number C, sodium, and option number D, magnesium. So what is the answer for this question? So the answer for this question is option number C, that is sodium. So we will have a small explanation regarding the depolarization and the repolarization. Okay, so in depolarization what is happening is it is caused when positively charged sodium ions rush into a neuron with the opening of voltage gated sodium channels. Okay, so sodium is the key element, key electrolyte in the depolarization. Okay, so sodium related gated voltage gated sodium channels are the key part. Then in repolarization it is caused by closing of the sodium ion channels and opening of the potassium ion channels. Okay, so depolarization, depolarization by sodium gated and repolarization by potassium ions. Okay, so that's the difference. I think you got the point. Now I think we can move on to the next question, that is the 8th question from the skeletal system. So the question is, bony thorax belongs to dash. Bony thorax belongs to dash. So the options are appendicular skeleton, option number B, axial skeleton, option number C, pectoral girdle, and option number D, sesamoid bone. So this bony thorax is belongs to which? That's the question. So the answer for this question is option number B, that is axial skeleton. So with the help of a diagram, I will be explaining regarding this axial skeleton and the appendicular skeleton. So the picture what you are seeing in the screen right now is the appendicular skeleton. Okay, you can see here. So it is a portion of the skeleton of vertebrates which consists of the bones that support the appendages. Okay, so from the name itself, appendicular skeleton. So there are total 126 bones in the appendicular skeleton, and the appendicular skeleton include the skeletal elements within the limbs, that means the upper limb, the lower limb, as well as the supporting shoulder girdle. You can see the shoulder girdle here and the pelvic girdle. So the appendicular skeleton includes the shoulder girdle, the upper arms, upper limbs, the lower limbs, and the pelvic girdle together forms 126 bones. Okay, so that is the appendicular skeleton. Now we will see about the axial skeleton. So this is the picture of the axial skeleton that is shown in the light blue color. So the axial skeleton includes the bones that forms the skull, laryngeal skeleton, vertebral column, and thoracic cage, and it all together 80 bones are there. Okay, so you can see the skull, the larynx, the thoracic cage, and the vertebral column. All these things forms the axial skeleton that supports the axis of the body, and it includes total 80 bones. So in the appendicular skeleton we have 126 bones, and in the axial skeleton we have total 80 bones. Okay, so these are some additional information for you. I think you got about this point with the help of this diagram. Then I have given you two more options. The next option was regarding the sesamoid bone. So what is a sesamoid bone? So sesamoid bone is a small bone that is commonly found embedded within a muscle or tendon near the joint. Okay, so we have several sesamoid bones that you can refer later. Okay, so we have very limited time, that's right. So that's all regarding that question. Now we will move on to the 9th question in our series, and the question is: complete glucose reabsorption happens in which location of nephron? So this is from the nephrology. So the question is: complete glucose reabsorption happens in which location of nephron? So the options are: first option is proximal tubule, second option is ascending loop of Henle, third option is descending loop of Henle, and the final option is distal convoluted tubule. So where complete 100% glucose reabsorption happens? So that's the question. So the answer for this question is option number A, that is proximal tubule. So at the end of this question you will be understanding from which all areas which all nutrients are getting reabsorbed. So first we will see the answer for this question, the early proximal tubule. So in the early proximal tubule, 100% full glucose will be absorbed, then 100% amino acids will be reabsorbed, then 90% of bicarbonates, 65% of sodium, then chloride, phosphate, and 65% of water. Okay, so these many things are getting absorbed in the early proximal tubule. For exam point of view, you can remember like almost 100% glucose and amino acids, and 90% of bicarbonates, and 65% of water. So those things at least you should remember from early proximal tubule. These many nutrients are getting reabsorbed. Then comes the thin descending loop of Henle. Okay, so in the descending loop of Henle, the only thing that is reabsorbed is water. Okay, so this is another important point for you. Water is only absorbed in the thin descending loop of Henle. Okay, then next comes the thick ascending loop of Henle. Okay, ascending loop of Henle, it is thick. So here 10 to 20% of remaining sodium, then chloride, then indirectly induces the paracellular reabsorption of magnesium and calcium. Okay, so here in the ascending loop, the main thing is the sodium, that is 10 to 20%, and potassium also is there. Okay, so that is the thick ascending loop. Then comes the distal convoluted tubule. So in the distal convoluted, early distal convoluted tubule, sodium and chloride will be reabsorbed, and in the collecting tubule we can see 3 to 5% of sodium, that remaining 3 to 5% of sodium and the remaining water will be reabsorbed. Okay, so I think that is clear for you. So from each location what all things are getting reabsorbed, that is also very important. Now we will move on to the 10th question in our series, and the question is: which nerve injury results in a positive Trendelenburg gait test? So we have so many things related to Trendelenburg, sir, because the Trendelenburg position is there, Trendelenburg for varicose vein it is there. So here I am asking about the Trendelenburg gait test. So which nerve is positive if the Trendelenburg, which nerve is affected if the Trendelenburg gait is positive? So the options are: option number A, superior gluteal nerve; option number B, inferior gluteal nerve; option number C, pudendal nerve; and option number D, obturator nerve. So what is the answer? So the answer for this question is option number A, that is superior gluteal nerve causes positive Trendelenburg gait test. So we will see what is the Trendelenburg gait test. So it occurs, Trendelenburg gait occurs when a patient has paralysis or paresis of the hip abductors, and the hip abductor weakness may be caused due to the neuronal injury to the superior gluteal nerve, either due to a nerve entrapment or by iatrogenic factors. Okay, so the superior gluteal nerve is the injured nerve in the Trendelenburg gait. Okay, so how we can elicit this test? So the patient is asked to stand on one leg for 30 seconds without leaning to one side. The patient can hold on to something if balance is an issue. Okay, so the therapist observe the patient to see if the pelvis stays level during the single leg stance. Okay, so the patient is asked to stand in one leg, and if the pelvis is in the same line, then we can say that the test is negative. So if the patient tilts to one side and the patient is having in a trendelenburg gait, then we can say that the test is positive and the superior gluteal nerve damage is there. Okay, so that is the trendelenburg gait test. Now we can move on to the 11th question in our series. So the question is, dash is a medical condition which is characterized by the growth of cells that proliferate on the inside of the uterus. So the question is, growth of cells that proliferate on the inside of the uterus. Okay, so there are chances that you may confuse the options. So options are option number A, endometriosis, option number B, adenomyosis, option number C, endometritis, and option number D, uterine prolapse. So what is the answer? So the answer for this question is option number B, that is adenomyosis. Okay, this is not endometriosis. Okay, so we can see the difference in the explanation session. So adenomyosis, it is a medical condition which is characterized by the growth of cells that proliferate on the inside of the uterus, that is the endometrium, atypically located among the cells of the uterine wall, that is in the myometrium itself. As a result, thickening of the uterus happens. That means the uterus will become bulky. That is adenomyosis. Then what is endometriosis? That is different. So endometriosis, it is a disease of the female reproductive system in which cells similar to those in the endometrium grow outside the uterus. Okay, so in the adenomyosis the growth will be inside only, but in endometriosis it will go outside the uterus, and these lesions can be found on ovaries, fallopian tubes, tissues around the uterus and ovaries, then intestines, bladder and diaphragm, and it may also occur in other parts of the body. So endometriosis is outside the uterus and adenomyosis is inside the uterus. Okay, so the other two options also we can see. The another option was endometritis. So itis, that is inflammation. This is the inflammation and infection of the uterus, and postpartum endometritis is the most common postpartum infection. Okay, so another key message for you, postpartum endometritis is the most common postpartum infection. Okay, so the next option was regarding the uterine prolapse. So it is a form of pelvic organ prolapse in which the uterus and a portion of the upper vagina protrude into the vaginal canal, and in severe cases through the opening of the vagina. Okay, so that is uterine prolapse. So it is most often caused by injury or damage to the structures that holds the uterus in place within the pelvic cavity. That means the ligaments. Okay, so that is uterine prolapse. So from this question you are getting information regarding endometriosis, endometritis, adenomyosis and uterine prolapse. Okay, so that was very useful for you. I think we can move on to the next question in our series, that is the 12th question. So and the question is, portal hypertension is defined as a hepatic venous pressure gradient greater than dash millimeter mercury. So several times we are getting questions regarding the portal hypertension, like regarding the other features of portal hypertension. Very regularly we are getting questions. So this is an additional information for you. So when we can tell a hypertension as a hepatic venous portal hypertension. So that is a question for you, and the options are option number A 2 millimeter mercury, option number B 7 millimeter mercury, option number C 5 millimeter mercury, and option number D 10 millimeter mercury. Portal hypertension. So the answer for this question is option number C, that is 5 millimeter mercury. So from this question we will be learning so many important terms which are associated with the portal hypertension. Okay, that we will see in detail. So first of all, what is a portal hypertension? Portal hypertension is the abnormally increased portal venous pressure, that is the blood pressure in the portal vein and its branches that drain from most of the intestine to the liver. So that is the portal hypertension. So that is the first thing. Then you should understand what is the portal venous pressure. So portal venous pressure is the blood pressure in the hepatic portal vein. Okay, it is the blood pressure in the hepatic portal vein, and the normal is between 5 to 10 millimeter mercury. So this is portal venous pressure is 5 to 10 millimeter of mercury. Okay, so that is another important point. Now we will see what is a gradient, that is the hepatic venous pressure gradient or HVPG. So it is an estimate of the pressure gradient between the portal vein and the inferior vena cava. So this is a HVPG is the pressure gradient that is between the portal vein and the inferior vena cava. So now we will see an HVPG of more than greater than or equal 5 millimeter mercury defines the portal hypertension. So if the HVPG is more than or equal to 5 millimeter mercury, then we can tell it as portal hypertension. Okay, so the measurement exceeds, if the measurement is more than 10 millimeter mercury, that means the HVPG is more than 10 millimeter mercury, then it is called as the clinically significant portal hypertension. So more than 5, portal hypertension, more than 10, that is clinically significant portal hypertension, then more than 12, then that is we can see variceal hemorrhages may occur, that is esophageal varices and all. No, that hemorrhage can happen if it is more than 12 millimeter of mercury. So this is a diagnostic thing, that is this is a hepatic venous pressure gradient is a diagnostic thing in the diagnosis of portal hypertension. Okay, so I think that was very important and very informative question for you. Now I think we can move on to the 13th question in our series, that is from the ophthalmology. So the question is, strabismus can be assessed by which test? So what is strabismus and how that can be assessed? So here comes the options for you. So the options are option 1, Snellen chart, option number B, confrontation test, option number C, ocular tonometry, and option number D, Hirschberg's test. So which is the test which is used to assess strabismus? So the answer for this question is option number D, that is the Hirschberg's test. Okay, so the Hirschberg's test, also known as the Hirschberg corneal reflex test, it is a screening test that can be used to assess whether a person has strabismus. And the other options we will see, what is a confrontation test. So confrontation visual field testing involves having the patient looking directly at your eye or nose and testing each quadrant in the patient's visual field by having them count the number of fingers that you are showing. So it is a basic test for visual field testing, that is a confrontation test. Hirschberg for strabismus, confrontation for visual fielding. Then another 2 more tests were there, that is a tonometry. Tonometry, it is used to determine the intraocular pressure, that already we have explained in our older videos. Then Snellen chart also is an eye chart that can be used to measure the visual acuity. Okay, so visual acuity, Snellen chart, tonometry, intraocular pressure. So I think that also was clear for you. Now we will move on to the second last question in the series. It is a picture based question. So I have shown you an instrument in the screen right now. So your task is to identify the instrument. Okay, so identify this instrument. Very simple, very easy question. So the options are, first one is a Cocker forceps, option number B, sponge holding forceps, option number C, Alice forceps, and option number D, dissection forceps. So what is the answer? Identify the forceps. So the answer for this question is very easy, option number B, that is a sponge holding forceps. So we will have an explanation regarding all these forceps and its purposes. So sponge holding forceps are used during the surgical procedures to hold sponges and swabs. Okay, as the name indicates, so this is the place where the sponge is held, and easily we can identify with the shape of this forceps. Okay, so the other options we will see. So next option was regarding the Cocker forceps, and you can see the picture of Cocker's forceps in this, and the tip is magnified here. Okay, so they can easily we can understand. So it is used to grasp the heavy tissue or clamp larger blood vessels to control the bleeding, and it can be used for intestinal, gallbladder or thyroid procedures. Okay, so this is a Cocker's forceps. Then next option was the most common Alice clamp or the Alice forceps. So you can see the picture of the Alice forceps in the screen. So it is a surgical instrument with sharp teeth. You can see here the teeth is very sharp, which is used to hold or grasp heavy tissues, and it is also used to grasp the fascia and soft tissues such as breast or bowel tissue. Okay, so this is the AIIMS forceps or AIIMS clamp. So one more option was there, that is a dissecting forceps. So this we are using from our +2 onwards. So this is the dissecting forceps, and you can see the picture here. So dissecting forceps are used in the laboratory and clinical environments for grasping and holding. So products are available in a range of lengths, shapes. Then we will be getting straight dissecting forceps, curved blunt, then a rat tooth flat, then fine pointed, etc., and jaw types also. So there are several types of dissecting forceps are there. This is a basic one. Okay, so this is a dissecting forceps. So you are getting information regarding the 4 surgical forceps from this question. Okay, so now we will move on to the last question in the series, the 15th question from psychiatry. Question is: difficulty with skilled movements even when a person has the ability and desire to do is termed as dash. So difficulty in doing the skilled things, that is in simplest way we can tell like that. Skilled movements even when a person has the ability and desire to do them is termed as. So the options are: option number A, agnosia; option number B, apraxia; option number C, aphasia; and option number D, altruism. So the answer for this question is option number B, that is apraxia. So we will explain these terms. So apraxia, it is a motor disorder which is caused by damage to the brain, specifically the posterior partial cortex or the corpus callosum, which causes the difficulty with motor planning to perform task or movements. That means the patient has the desire and patient know that how to perform, but they are unable to do that. So this is a motor disorder in the posterior parietal cortex or the corpus callosum, that is apraxia. Then comes the agnosia. So it is the inability to process the sensory information. Okay, so this is the inability to process sensory information, and there is a loss of ability to recognize the objects, persons, sounds, shapes, smells, while the specific senses are not defective, and there is no significant memory loss also. Okay, so there will not be any problem with the sensory organs, and there will not be any significant memory loss also, but the patient will be there will be inability to process the sensory information. So that is agnosia. Then comes aphasia. So that is the inability to comprehend or formulate the language because of damage to the specific brain regions. Then comes the altruism, that is extremely different from all these options. So this is the principle and moral practice of concern for the welfare and or the happiness of other human beings or animals, resulting in a quality of life, both material and spiritual. So that is altruism. Okay, so you will be learning about the 4 terms, that is agnosia, apraxia, aphasia and aphasia. Okay, so with these 4 terms we are coming to the end of this session. So in this session also we have explained very well regarding 15 questions and its related terms and conditions. So I think it was very helpful for your upcoming examination. So thank you for watching the video till the end without skipping. So I request everyone who are watching this video to be in touch with us, so that we will be uploading the next series very shortly. So till that time, just signing out. See you in the next video very shortly.